Besides paying interns, they should pay them. Even President Museveni, the president of the country, General Museveni,
is being paid.
Wrote a letter confirming that the interns' work is very valuable and should be paid. In 2021, I even have a copy of that letter I can share with you.
So many years we have been slaves without having real freedom, and now we have freedom, freedom, freedom on the part of Africa.
Hello everyone and welcome to the show. My name is Eam Wycliffe and I'm the host of the day. Today we are bringing you the matter of discussion sparking off a lot of conversations in the medical health sector in Uganda. And this is the part where Uganda government has failed to pay medical interns.
It is not new that Uganda is paying the intern doctors. It's not like Uganda is doing a favor. The entire globe, everywhere, intern doctors are paid. Let us look at Kenya.
Oh, okay.
Intern doctors are paid 7 million per month.
Per month?
Yes.
You have to remember that behind every doctor, every nurse, everyone that is in the health sector is years of sacrifice and dedication. This is where I bring to you, I'm very honored, by the way, to bring to you the best doctor in the field. And this is other than Joel Mirembe, Dr. Mirembe. Everyone must know that this is a distinguished guest and I'm very honored to have him on set. Hello, doctor. I'm very glad to have you here.
Thank you very much, Wycliffe. My name is Mirembe Joel. I'm a medical doctor. I'm a lecturer. I'm a former Secretary General of the Uganda Medical Association. Of course, for context of the issue that we are going to discuss, I have been a leader in the healthcare profession for quite a long time, around 10 years. And around 2018, when I was leader of the national leader of all the medical interns in the country,
Wow.
I started the Federation for Uganda Medical Association with my team. We started it, and it's the official legal voice that is engaging government on these matters and bringing together all the medical interns. Of course, I have been in other leadership positions, but for context of what you said, we don't have best doctors. Okay. All doctors are good, but maybe I am fit to discuss this matter with authority. I've been an intern, I've been a leader of interns, and I've been a leader at the national level. Uganda Medical Association is the umbrella body that brings together all medical doctors in the country. So we are saying no, and not just a no, a big elephant-like, whale-like no to the deliberate slavery, servitude, and exploitation of fresh graduate doctors and other health workers.
Wow, wow. There you have him, Dr. Joel Mirembe. So, Dr. Joel, if you had just 6 seconds to explain to an average Ugandan, or someone who may not know why medical intern allowances are important to them, what would you say?
Before I utilize the 60 seconds, let me first educate the people and make them understand who an intern doctor is.
Okay.
Generally speaking, by English standards and lay talk, an intern is someone under training. For example, you are doing a business and then during your part of your training, you're probably sent to facility X to practice accounts. Now, the people we're talking about did that during training. In fact, in my year 3 in medical school, I started going to hospital and cracked patients, and then I was trained to crack patients. I was trained to do all these other things.
Yeah, understand.
And it is that qualified them to graduate. Now, the intern we're talking about is not a student. This is a fully graduated medical doctor who has a provisional license from the Uganda Medical and Dental Practitioners Council. This is a government body that licenses and regulates doctors. It doesn't license and regulate students. It doesn't register students anyway. It registers qualified doctors. Then for the nurses, it is someone who has finished, graduated, they have their transcript from their university, and the nursing council has to give them a provisional license. You cannot begin to work without a license. So this intern doctor works in government hospitals. The internship word is a global word in medicine to mean people who have freshly graduated from medical school. And because for us, we are advantaged or disadvantaged that we deal with people's life. So there was a global kind of resolution that whoever is going to touch life, you see doctors are the leaders of the healthcare profession naturally, should first work under an experienced hand, supervision. You get it? This is a supervision role. Now, this studio and this media house, you have staff. And when you bring in new staff, you attach them supervisors, not because they don't know what they are supposed to do, but there are norms to learn in this institution that are not where probably they have been. Then too, accountability, okay, of whatever you're doing. So the intern doctors are simply working under supervision. They are not student like how government wants to trade that such that they can run away with it without accounting. It is not new that Uganda is paying the intern doctors. It's not like Uganda is doing a favor. The entire globe, everywhere, intern doctors are paid. Let us look at Kenya. Intern doctors are paid 7 million per month.
Per month?
Yes.
Hey.
They are paid more money than actually the Ugandan starting doctor in public service of Uganda. Let us look at Rwanda, they are paid. Tanzania, they are paid. Even South Sudan, which some of people call a failed state, is paid.
It's kind of fair.
You get it? So it is not a favor that government is doing. So that is, and let me quantify why they should even be paid. When I was an intern doctor, I did over 50 cesarean section operating on a mother. Over 50. A cesarean section at a Kawempe National Referral Private Wing is 2.5 million.
Yeah, they weren't paying
So
you then.
let us see, calculate 50 times 2.5 million. How
That's
much money is that?
That's a lot of money.
Government for an entire year paid me only 11 million. For an entire year, 12 months. Now, add the other operations I did, because those are not the only ones I did. I just used that one because it's a common operation that people know.
Okay.
Then later I was transferred to Mulago. Did the same. Then later I was transferred to Chirundu. I did the same. So how do the intern gives more to the economy than what government is giving them. So there is no any sort of justification that actually intern doctors should not be paid. Thank you.
Wow. So you hear his argument. So now, doctor, we would also want to know what are the effects of not paying an intern doctor?
Of course, the effects are multifaceted, multi-pronged. Why? The patient will be negatively affected.
True.
The will, interest of younger people in school to fight and do sciences such that they can enter the health profession will also be affected negatively. That means students will are going to be hesitant to focus and suffer to do science, because the truth is that some of us who did, I don't know, but doing science is a very hard thing.
Yeah, it was very hard
You
in
know,
school.
getting those A's was not easy.
Getting biology right, really.
Yes, you know, by the way, this is not blowing out no trumpet.
Yeah.
Doing the sciences was hard.
It was
We
hard.
got the A's, but I can tell you it was very hard.
Hard.
Now, after students suffering to that kind of level, and medical school itself, you know, when we went to Barara, when we were studying medicine and surgery, we had colleagues who dropped out in his first semester. Why? These people were on government merit. They could not just tolerate the experience of working with dead bodies. Because in year one, we work with dead bodies. We are cutting dead bodies.
Yeah,
we are
cadavers
doing
every
this
time.
and all that stuff. You get it? So they left and went for other courses. Now, there is no way someone... So going back to the question, one, the current staffing gaps of Ministry of Health are glaring. Ministry of Health data shows that government, where it needs 10 doctors, it has 2. That means around 20 to 30% staffing. That means there is about a 70%, 60% gap left. And who is filling that gap? It is the intern doctor. So, one, the intern doctor, the common person is going to suffer because they are not going to get services. The queues are going to become longer and they are not going to be worked on. Okay? 2, the intern doctor is going to be very frustrated, mentally, psychologically disturbed, because you know you cannot keep saving others when you are not aware, when you're not sure of your rent, when you're not sure of food, when you're not sure of a fair starting life.
Yeah, true.
Yet every day you see what comes to us as a health worker. This is misery. Now, someone brings their misery of being sick, which it is not their choice that they are sick.
Yeah, true.
You are supposed to alleviate. You're supposed to comfort. You're supposed to reassure. You're supposed to take out their pain. Yet you already have pain. So this month, I saw Ministry of Health declaring it a mental health month. Yet the same ministry is causing depression, mental health breakdown for its young people. So the dangers are to the patient. The patient is not going to receive the care. Those who receive the care, assuming the inevitable happens that they are deployed without pay, these people will not be settled, so the quality of care will go down. Those who are aspiring to join healthcare are going to reduce. There is going to be an increase of brain drain. We did, I think around 2019, a survey was done among medical students, asking them where they want to work after. Most of them never wanted to work in the government hospitals.
They wanted to work in private
Private
hospital.
outside.
Now
Uganda.
that takes me to another question.
Yes.
We've seen that many doctors, after graduating here in Uganda, of course they do their courses here in Uganda. We believe that Makerere and other institutes are good when it comes to teaching such courses, right?
Yes.
So after them acquiring their certificates and all that, they go ahead and move abroad. Now, why? I have this question. Why are many healthcare professions leaving Uganda? That's a question I've been asking myself. Leave alone this being, leave alone the interns not being paid. But what, are we not paying them well? Or they're just not comfortable with the environment here in Uganda?
Of course, the working environment is not very enabling. But I will start. I saw when the new parliament, old parliament was opened, the Right Honorable Deputy Speaker of Parliament, Honorable Thomas Tayebwa,
Yeah.
said
This
that
12th parliament, right?
yes, the 12th parliament
Mm.
said that you, the medical board, are delaying to clear honorables to go abroad for treatment. My question to him: why are they going abroad? Why don't they come to Mlago? Why don't they go to Guru Regional Referral? Why don't they go to Kabale Regional Referral and we treat them? Are they saying that we're not qualified?
Of course, you're qualified.
They are usually referred to Kenya, Nairobi.
Mm.
And the people working there, many of them are colleagues. They are young doctors from Uganda. They are young doctors, senior doctors from Uganda. And many of the consultants here in Uganda are consulting with Kenya hospitals. Okay? They fly and go and do surgeries and come back. So the question is a system that is not enabling us to function well. That's why they also know they have not funded, they have not provided leadership, they have not done their part to put the healthcare system right. So they fear to come to these hospitals.
Mm.
You get it?
Yeah, I get the point.
So the reason why people are leaving are many, but one of them is that government is not recruiting doctors. We have very many specialists who have
But here
finalized.
we have a budget every year that is specifically targeting hospitals and healthcare.
Yes, there is a declaration that Uganda is signatory to, the Abuja Declaration. It says every government of Africa should spend 15% of its budget on its health care. Now, Uganda spends less than 4%.
That's
the last 4 years, 5 in fact, government had put a cap on recruitment of doctors. Government has not recruited. Even COVID was here, and it is you saying rather which recruited doctors for government. And he paid them. I was one of those doctors. You said he paid us. You get it? And we were working in the government hospitals. So there is lack of priority. The priorities are buy MPs a 300 million car. The priorities are give each MP 100 million. The priorities are spend 100 billion, okay, on spend 100 billion plus on Lubowa, which has not even left the foundations. Yet Tanzania has built a hospital that is bigger than Lubowa at 50 billion. The priorities of government are give MPs some money so that they vote a candidate of your choice politically. So until when we align our priorities right, healthcare will be good, and these MPs, one of the first things should be done. And the interns were paid that money until 2 years later when Nabanja became prime minister and scrapped that pay. She just said, we said, okay,
but
we put up with her pain.
He's a good speaker, but I mean,
no, it
has been a good honorable.
What I'm saying are facts. I don't allege. Okay, I'm not alleging that decision was made by the office of the prime minister. They had also proposed to cut off. So there is no explanation for not paying that doctor. Even the president himself knows how valuable these are because they feel the 70% staffing gap. These people are working day and night. You know, an intern is called a junior house officer. In medicine, the moment they say house officer, it means you are supposed to be on duty 24/7. Even when you have gone to shower and there is an unresolved patient, hello, Orudeo.
I know.
That's the moment they attach the word house on any card. It means your work is 24/7 duty. You only go to sleep. After your sleep, you are even in serious countries, they even monitor you just like that. You are on duty. And the reason why they put you under that kind of, such that you are exposed to all manner of diseases in treating them. Okay. When they finally leave you to practice on your own, the chances of error are very minimal. So, government ina kyetugamba. Kiyamba yo okusasula ba intern doctor. Kiyamba bana Uganda. And I'm calling upon Ugandans that this issue, one, I have seen good momentum. I've seen the Archbishop Kazima Mugalu speaking to this. the General David Sejusa speaking to this, and so many others. I call upon now the ordinary. General Sejusa will not go to these facilities if he wants. He can fly out, and so is the Archbishop. So you pick up this issue from the LS1 chairperson to the national area. You should make life hard for your MPs until when they approve, pay for your doctors, because these are the doctors of the ordinary person. This is the frontline doctor that is going to work on you. So take up this issue. And lastly, the policy that Honorable General Ruth Acheng signed, the First Lady Jane Kadaha Museveni signed, and the PS signed, is illegal and unconstitutional. It violates very many articles of the Constitution that probably we may not go through now. We have already consulted our legal officers. We are not stepping back. We are going to push this until when the right things are done. Thank you.
Okay. Banaye, teri kubakinga down. Dr. Mirembe is so serious about this. Now, Dr. Mirembe, before we end this show, I have a simple question. I believe you have answers. Of course, prior, you had given us solutions, but I want you to give us a way forward and what should be implemented in this healthcare system to make life easier for each Ugandan out there.
Yes, in brief, one, government should first withdraw that policy of medical interns. Take a thorough stakeholder engagement process to build the consensus on training of doctors and their welfare after training, including recruitment. Two, government should cut expenditures from other areas. Areas like breakfast for MPs. You know, the annual breakfast budget for MPs is enough to pay medical interns like for 3 years. When everyone is paid, no one is striking. Why are they giving breakfast money to people who are paid over 50 million every month?
But you have to eat.
So why are you giving? Are they implementing the Bible verse?
Doctor, don't you get breakfast at the hospital where you work?
I don't. And I'm not paid 50 million. I'm paid way far less than that. I don't. Are they implementing this Bible verse that those who have much, those who have little will be taken and given to those who have much? That is wrong interpretation of scripture. MPs, the budget for MP breakfast is enough to pay medical interns for an entire year, because they need just around the 25 to 50 billion to pay all of them, over 2,000 people. You get it? Over 2,000 people. Now you are giving this money. They should stop creating new constituencies. Okay?
I believe
they should divert the budget for treating government officials abroad to pay medical interns. Because that budget, Attorney General's report shows it's around now, I think around 300 billion.
300 billion.
Let them come to Mengo. Let them come to government hospitals to Bajanjabi. Then they will understand why we are speaking. And we are telling them, we are not going to stop calling you out as you continue to do wrong. Please, government should specialize in doing the right thing, in responding to problems of its people, not rather to begin explaining why they are not doing right.
Okay.
This particular policy exposes how ill-intentioned the former Minister of Health and the Minister of Education were, or they are. Because almost it has a few merits, and most of the things it has are not good. They are not promoting quality care. They are instead oppressive.
Yes. Doctor, indeed, this has been a great show. I really thank you for coming. Now, before we close, I would like some closing remarks. Or what message would you want to send to the health medical intern out there and healthcare, our future also? I'd love to see what you have to say about our future in a brief.
Yeah, the future should be bright, but certain select individuals want to make it bright and dark. Something we are not going to accept. For government, there is a full national planning authority. The Ministry of Finance has a planning department and a minister for planning in particular.
Oh,
These people are well facilitated. They need to plan. Government has been saying that the interns are too many. That's a lie, because even that very policy is saying that they need more 20,000 medical students in medical schools. 20,000.
wait, doctor, before I interject,
Yes.
I have a question I didn't ask earlier. So, these students that are in government schools, let's talk about Makerere and all other schools in Barara,
Yes, Lira.
Lira, and also the private one, the ones in private. Are they also to be facilitated? Like, we have to facilitate the ones in private and also the ones in government.
No, at the level of internship, there is no student. These are qualified doctors. They are all Ugandans. Their parents or themselves pay tax.
No matter the school.
The money facilitating them is not any individual's money, it's taxpayers' money. They are treating all Ugandans. So all of them should be facilitated. And I let me go back to my submission. They should plan. First of all, we should know how many students we have enrolled in medical school file. How many are progressing to the next year? Such that by the time these people graduate, they are full doctors, they are full pharmacists, they are full nurses. We have already reserved a budget to pay their allowances. Okay? Then they should be appointed on probation so that they can get into public service, so that we can attract to retain them into government and they work for government. We should have that process. These things of crying around that they are going abroad because they are not being absorbed yet, the vacancies are there.
Yeah.
So I want to, as we end,
yeah.
I want to tell the interns, Temuzikiza, let us increase the scrotal traction such that the pain is much and whoever is feeling the pain will do the right thing. Let us get engaged respectfully. Don't abuse. Be ethical, be professional, but be serious and unrelenting on this good cause. Thank you. For God and my country. Sabasaja Kabaka Uganda Wangali.
Scrotal friction, he said.
Traction.
Scrotal friction. Traction.
Yes.
Sorry for my English. So everyone, it has been the show. I'll be hosting these distinguished guests from all over the Ugandan health sector. Please be tuned, and I'm glad you've subscribed, like and share. Thank you. Next time. Bye-bye.
Nawuliranga leero amateeka gonna goonoteekanga n'agakwatanga kisaza